Hello, my name is Leonel Sabaya. Today I'm going to demonstrate on how administering oxygenation through cannula and mask. Oxygenation method, which is oxygen is supplemented at a higher percentage than what is available in atmospheric air. The purposes are to relieve dyspepsia, to reduce or prevent hypoxemia and hypoxia, and to alleviate associated with struggle to breathe. The equipments are going to use today is Klein's charts and Candex, oxygen connecting tube, flow meter, humidifier filled with sterile water, oxygen source, wall outlet or oxygen cylinder, tray with nasal cannula of appropriate size, and oxygen mask. We have in the tray, adhesive tape, scissors, cylinder stand, gauze, or cotton swab if needed. And we have no smoking signboard, and gloves. Check the doctor's prescription including the date, time, flow, liter per minute, and method to avoid medical error. Perform hand hygiene and wear gloves if available to prevent the spread of infection. Good morning. My name is Leo. I'm your caregiver today. Can you please state your name and date of birth? And check your wristband. Today, ma'am, the procedure we're going today is administering oxygen through cannula and mask so you can breathe properly. Lighting and matching or smoking cigarettes is dangerous. Make sure that you don't have all these things. Is that okay? Prepare the oxygen equipment. Attach the flow meter into the wall outlet or oxygen cylinder. Fill humidifier about 1/3 with sterile water or boiled water. Humidification prevents drying of the nasal mucosa. Blow out dust from the oxygen cylinder. To prevent entering dust from excess of cylinder to the nostrils. Attach the cannula with the connecting tubing to the adapter on the humidifier. Test flow by setting flow meter at 2 to 3 liters per minute and check the flow on the hand. Testing flow before use is needed to prevent prescribed oxygen to the client. Adjust the flow meter settings to the ordered flow rate. The flow rate via cannula should not exceed 60 liters per minute. Higher rate may cause excess drying of nasal mucosa. Insert the nasal cannula into client's nostrils. Adjust the tubing behind the client's ear and slide the plastic adapter under the client's chin until he or she is comfortable. Proper position allows unobstructed oxygen flow and eases the client's respirations. Maintain sufficient slack in oxygen tubing to prevent the tubing from getting out of place accidentally. Encourage the client to breathe through the nose rather than the mouth and expire from the mouth. Breathing through the nose inhales more oxygen into trachea, which is less likely to be exhaled through the mouth. Initiate oxygen flow to maintain doctor's prescription and avoid oxygen toxicity. Assess the patient responses to the oxygen and comfort level. Anxiety increases the demand for oxygen. For administering through oxygen mask, attach the humidifier to the threaded outlet of the flow meter or regulator to maintain proper setting. Connect the tubing from the simple mask to the nipple outlet on the humidifier. Set the oxygen at the prescribed flow rate. The oxygen must be flowing before you apply the mask to the client. To apply the mask, guide the elastic strap over the top of the client's head. Bring the strap down to just below the client's ears. This position will hold the mask most firmly. Gently but firmly pull the strap extension to center of the mask on the client's face with a tight seal. The seal prevents leak as much as possible. Support helps relieve apprehension and lowers oxygen need. Remove improperly disposed of gloves. Wash your hands. Respiratory secretions are considered contaminated. Place no smoking signboard at the entry into the room. The sign warns the clients and the visitors that smoking is prohibited because oxygen is combustible. Document the following: date, time, method, flow rate, respiratory condition, and responses to oxygen. Documentation provides coordination of care. Sometimes oxygen inhalation can bring oxygen intoxication. Find the chart to maintain professional accountability.